So 5 things to get your health in order. First is your annual physical, coordinating your care, getting a care team together, thinking about advanced directives, managing your medications, and healthy strategies for coping with stress. So your annual physical, starting with the first one, should be annual. So what are some things that you could do to plan ahead to make your annual physical annual? A lot of people don't like to go to the doctor. I know. But it's really important that you do, because your health changes. You know, even though you're doing the same old thing, sometimes your body can change. So pick a time that your annual physical will happen on the same time of year every year. So it could be your birthday, could be the first of the year. You pick it. It's up to you. When your insurance, starts every year, it's very, very important for you to do it every year. And Medicare now pays for it, a good amount of time for your doctor to interact with you for your annual physical. So prepare for your appointment too. So don't just go in and have the physical and then walk out and say, oh, I should have asked the doctor that. Oh, I meant to ask the doctor that. Make a list ahead of time of things that you want to talk about. Is your eyesight going? Is your hearing? Are you getting dizzy, like Anat said? Have you fallen lately? Anything you want to talk about, prepare ahead of time, okay? Have a list. And be sure to do all of the things in the follow-up that your doctor wants you to do. So I know the last time I went in, they asked me about different immunizations, like, did I get a shingles vaccination, because I'm at that age now? Did I get a pneumonia vaccination? There's a lot of things that we can do to help prevent complications in the future. Obviously for women, mammograms. For men, prostate exams, colonoscopies, diabetic care, things like that. These are all preventative items that can help us stay healthy. And if your doctor said to you, well, he saw some skin tags or moles, and he said, follow up with the dermatologist. Make a list of the things you have to follow up with and go home and make those appointments. I just remembered I went with my mom to her doctor, and the doctor wanted her to see another specialist, and I never made the appointment. So I'm reminding myself right now to make that appointment. So getting ready for your appointment, I said a few of the things like listing and prioritizing your concerns, right? So make sure that at the top of the list are the things that are the most important to you, because you may not get to all of them with your doctor, but at least you got the top 3. What other health changes? So think about, before you go to the doctor, if you've had any changes in the last year, and consider bringing someone with you. This is a great idea. So my mom is 90, and she's hard of hearing and hard of seeing, and so I really need to be her eyes and ears at the doctor's office. Now, I don't want the doctor to talk to me and pretend she's not in the room, but I will talk slowly in her correct ear and make sure that she understands what the doctor is saying, and that she can communicate to the doctor. And making the doctor understand, like, what is her priority in terms of what she's feeling. I also wanted to, I'm sorry, this is, so in bringing someone with you to the appointment is, obviously you have to want to share your medical information with that person. So, could be a spouse or a friend or a child or whomever it is you want to share that information with. But it's really important, because if you forget to ask those special questions that you want to ask, at least you can tell the other person, if I forget to ask those questions, please, invite the conversation or remind me to ask that question. And that way, sometimes you feel kind of embarrassed to ask your doctor, but if somebody else says, oh, Janet, you wanted to ask that question, it seems like a little easier to do. And make a note of any emergency, like if you went to the ER during that year or something changed dramatically, make sure you write that down so that the doctor will notice that, because not every healthcare system is integrated. So Kaiser, obviously, everybody has all the information of the other doctors. Cedars has information, but let's say you were on a trip and you went to the ER in another state or another city. They won't necessarily have that information, so bring that information with you or note it to the doctor. Also changes in appetite, weight, sleep, energy level, a recent loss or move. Now they ask you automatically. The last time I went to the doctor, they did a whole depression scale with me. I was fine before they asked me all the questions. Then I felt depressed after they said, they asked me the 10 questions. But anyways, if you do feel depressed because of a loss or a change, make sure you bring that up to the doctor, because sometimes they can offer you some, to go to a therapist or to consider other things. And take notes so that you can refer to them afterwards, or have your friend take notes. So what? A depression scale. So there's like 10 questions the doctors are asking patients when they go to them in general, because there's so much suicide and depression among all ages of people. They want to make sure that if somebody does say, yes, I've had a suicidal thought, or I feel depressed, or I don't want to get up 3 days a week in a row, that raises a red flag for the doctor, so the doctor can then make an appropriate referral to a mental health professional. So as I said, bring notes, bring your notes, bring your insurance and ID cards. Have that all ready so you don't waste precious time with the doctor. So you could get right to things. Also, make sure you have contact information for your other doctors, your specialists, and your loved ones if they need emergency contact information. Have that all ready to go. And also another partner is the pharmacist and the pharmacy, as Anat said, because you may be given a bunch of different medications from a bunch of different doctors that you've gone to, and sometimes they're for the same thing. And sometimes they interact badly, and the pharmacist will be the one to see. Now they get more information from different healthcare systems at the pharmacy, so they can spot if there's some interacting thing. So you can always have a consultation with your pharmacist, and try to use a single pharmacy for that reason, so you're not so one person can see all of the medications you're getting. If you fill your medications at the same pharmacy, then the pharmacist can see it all. If you get one at Rite Aid, one at Pavilions, and one at Costco, your pharmacist might not know that you're getting multiple medications for the same thing. And of course, have your advance directive. I'm going to talk later about advance directives. They're also called powers of attorney for healthcare. They used to be called living wills. They're not called that anymore. But in other words, think about who would make healthcare decisions for you if you couldn't, and we'll talk about that. What else can you bring? Let's see. Okay, so make sure you have your glasses on, your hearing aid in, your friend, your list, so that you can communicate well with the doctor, and the doctor knows what you want to talk to him or her about. Also, many doctors will want on your annual visit you to bring them all the medications that you're taking. So you can either write them all down, or you can just put them in a bag, bring them, and that way they can see what you're taking and what you're not taking, because maybe they discontinued things from a medication, but you never realized they discontinued it, and you're still taking it. So every time I go to the doctor, I notice they have my list of medications. So even if I got a cold and they gave me an inhaler and they gave me a decongestant and this and that, the next time I go in, they're saying, oh, are you taking this? Are you taking this? I'm like, no, that was just for my cold. I'm not taking it anymore. But it keeps repeating and repeating on the system. So it's important for you to let the doctor know what you are taking and what you're not taking. Alrighty. And a summary of your medical history is good to have, because when you go to a specialist, then you want to have a copy of your medical history that you've written yourself. It doesn't have to be the one the doctor writes. But what are your main issues, right? so that the doctor can see if you go to a neurologist that you are being treated for diabetes or you are being treated for a heart condition, because some of them could have an effect on the others. And we talked about creating a team. So that doesn't mean just the person that you're taking with you, who could be part of the team or not, but it means that your doctors, if you have multiple doctors, that one of the doctors will be your quarterback. And so that, let's go back, I didn't realize. So who will be your quarterback? So is it going to be your cardiologist, because that's the person you see the most? Is it your internist? Is it your gynecologist? So I would suggest it's the person that you can communicate with the best and the person who knows you the best. And usually that's your internist. But if you've had a heart condition and you go to your cardiologist 10 times more than you go to your internist, well, then maybe your cardiologist should be your quarterback. So maybe the cardiologist is the one who's communicating with your neurologist, with your endocrinologist, et cetera, to make sure that when they give you a new medication, it's not going to interfere with the plan of care that your other doctors have. So one doctor should be the one coordinating it all. And we said about using a single pharmacy, how important that is. Don't assume your doctors communicate with each other. You have to ask them to communicate, and that's why you appoint one to communicate with the others. And that's why you have a list of your health concerns, your main issues, and what the plan is for each one, so that when you go to that specialist or that other doctor, they could see right away, this is what your problems are. This is what the plan is. And if they give you a treatment plan, make sure that goes to all your doctors. What's your treatment plan? You know, keep your blood pressure at a certain thing. You know, keep your sugar levels at a certain level, or else if that doesn't happen in a month or two, then what are you going to do then? Where's the follow-up going to be? And you should be an active participant in your care. So it's not just the doctor handing you a pill. If he says, take this pill and lose 10 pounds and do some more exercise. So an active participant means that some of the responsibility is on you as well, not just taking the pill. But taking the pill is important, of course. So your role in communicating with doctors. There are some tips that help communication with doctors. Doctors don't have a lot of time. They have to spend so much time writing things down instead of talking to you, so you want them to talk to you. And so part of the way that you can do it is to establish a relationship with them, tell them that, make sure that they know what your issues are, be prepared, tell the truth, even if it's embarrassing. A lot of people don't want to share if their pills say, do not take with alcohol, but they like to drink alcohol. And that's, it's hard to not have that drink every month. Tell that to the doctor, because maybe he could switch the medication and give you one that's not going to be so affected by alcohol. All right? So tell the truth, even if it's embarrassing, because it could mean your life, and your health. And learn the doctor's preferred method of following up. So some doctors they're okay with you calling their office and talking to their assistant to get to them and get information to them. Some prefer you go through the portal of Kaiser or of Cedars, where you could just type a message to your doctor. There's an app I have on my phone, because my doctors are at Cedars-Sinai. I could just send a message to my doctor, and that's his actual preferred way of me communicating with him, and he will get back to me within a day and say, okay, come in, call, or go to this person, or do something else, or I'll send you a prescription to your pharmacy. So find out what that preferred method of communication is, because it'll make your life a lot easier, and it'll make the doctor's life a lot easier. And when you're still not being, if you have an issue that you still feel is not being addressed correctly, be a squeaky wheel, okay? Because you know your body better than anyone else. And if you think there's something going on that they're still not getting, okay, push a little harder or get a second opinion, okay? Or let somebody know that this is still bothering you so that you can get attention. So just personally, my son, when he was 7, he developed a tic. And I knew something was wrong right away. And it turned out to be Tourette syndrome. But I had to convince the doctor who thought it was just an allergy. And I said, no, there's something else going on. There's something else going on. So after we got that all sorted out, and I, talked to 2 or 3 people, and I looked up some information, and I said, yeah, I think that's it. He got diagnosed. That was his diagnosis. And then the doctor, many times, years later, said, I have another patient that has Tourette's. Would you mind if the parent talked to you? And I said, no, not at all. So sometimes we know our bodies and our children better than the doctors do. So the idea is to not suppress that. Let it, follow your gut. And then one more thing is, a lot of people misunderstand, or the communication isn't clear about what to do, what the doctor's directions are about your health care. So back to my mother's situation, right? So the doctor said, I want you to put 3 drops of this and 2 drops of this in your eyes and 1 drop of this, and et cetera, et cetera. So she couldn't really understand. So I said, this is what I heard you say. 3 drops of this, 2 drops of this one. Is that correct? Yes or no, that wasn't correct, or it's corrected. So repeat it back so that you're sure that you understand what the doctor said. And sometimes if the diagnosis is something that's a little bit shocking to you, you may have to make sure that you get it written down on a piece of paper so that maybe you weren't expecting this, and you know what to do. You know who to follow up with, when to follow up, etc., so that you got it right, okay? So communication is a big deal with medicines and medical care. There's a whole thing about medical literacy. So how people misinterpret the words on the paper, even because of language issues or cognitive issues or other things. And there's one example that I heard once where the patient was Spanish speaking and the pill said once a day. And once, O-N-C-E, in Spanish is once, which means 11. So maybe that person could interpret that as 11 times a day. So you want to make sure that if you have even a language issue, that you can bring in somebody to help you interpret that understands English better. Or the doctors and hospitals have interpreters on staff, and all you have to do is ask, and they have them available. Advanced directives we are going to go over. I just want to say that everybody who's 18 years of age or older should have an advanced directive so that if something happens to them, they have thought ahead of time who it is they want to make their healthcare decisions if they can't. And we will talk about that again. So, do you have one? Is it current? And do your doctors have a copy? How many of you have gone to the doctor and the doctor asks you, do you have an advanced directive? Yeah. And do they say, will you give us a copy? Yeah. Because that should be their next question. Now, sometimes the doctor might have an old copy, okay, and you've changed it. So make sure that you bring the new one if you do have a new one. Medication management, is that you, Anat? Okay, so because we want to help each other, Anat's going to do the second half of Sarah's talk, and then I'm going to come back and do the legal part. So thank you very much for your attention.
Okay, why don't we do a little stretch right now? Okay? Why don't we all sit up straight? Make sure that your feet are touching the ground. Okay, good. If those of you want to stand up, good. So either stretch forward or stretch up. Okay, side to side. And what I want you to do is remember to breathe. Inhale. Exhale. Any movement that you do, make sure you inhale and exhale. Let's do a little swimming or paddling forward. And whatever you do one way, let's do it the opposite way as well. Backwards. We call this brain elasticity, plasticity. What I want you to do is raise your foot, one foot, bring it down, raise your other foot, bring it down. And if you can, then slowly speed it up a little bit and do a little march. Again, if you need to hold on to the chair, please do so, or the table. And if you're sitting, you could still march. Good. Now, I do want you to hold on to the chair now and lift one leg up and hold it there for 5 seconds. And then set it down and hold the other leg 5 seconds and let it down. The next thing I want you to do is side to side. Again, don't bump into anyone unless you want to bump to say hi. Okay? Side to side. Side, step, side, step. Side, step, side, step. Are we breathing? Isn't it amazing how we forget to breathe? And where is your core? Are we tightening up our core as we're doing that? Okay, we got to focus in, tighten the core. Makes it more difficult, right? And breathe. Good. Okay, these small little exercises are so important, go a long way. Okay? Excellent. Someone shrug their shoulders. Great idea, right? We don't realize how tight it is. Do some up and down. Tighten it and relax. Tighten it and relax. And are you breathing? Yes. Excellent. Are we doing better, guys?
Yeah.
Excellent. All right. Have a seat. Have a sip of water. I'm just going to do a quick thing about the medication management. Know your medication. Know what you're taking. If it's prescribed as a pill and as a whole pill, don't go crushing it. Don't go breaking it because you want to extend that life and save some money. Let your doctor know that if you can't swallow a pill, you rather have a liquid form, let them know because not all medication are allowed to be crushed. Okay, you're changing the potency of the medication, okay? And when you're splitting it in half, that is not what the doctor prescribed you, okay? So it's not gonna work for you. Or the medication now made you feel good, you're feeling good. Well, I'm gonna put this aside for when I'm gonna feel bad again. Well, you're feeling good because you are taking the medication is working, okay? So very important to follow the way it's prescribed. Okay? With food, without food, bedtime, not bedtime. What's important is pay attention to any side effects. And if it's not one that's noted, call the doctor just in case. It may be something that they need to change up for you. Or it may be that they'll say, well, yeah, it's temporary. Keep taking it. Okay? But very important to keep that dialogue and let the doctor know. Okay. Okay, tracking the medication we talked about already. Okay, stress. Does anyone here not have stress or never experience stress? Okay, so we're going to talk about stress. So everyone, right, there's good stress and there's bad stress, right? There's good stress. You're going to try something new. There's a wedding that you're planning for. There's a date you're going to go on, right? The heart starts racing. You're getting all excited. Getting organized for something, that's good stress. But there's also stressors when it's an ongoing, right? You are concerned, you're upset, The heart is racing, you're sweating, you can't sleep, your stomach is all in knots, right? This is going to impact your health. This is going to impact your heart. This is going to impact your blood pressure. This puts an impact on diabetes, depression, anxiety, on and on and on, okay? None of us want this. So if you're experiencing some form of stress, let your health provider know about it, okay? There are some options, and I'm going to talk about things that you can also do on a day-to-day basis. Even just what we just did, right? So when we're sitting, we don't realize how tense our body is, right? Until you start moving it differently. Like, oh, I didn't know my shoulders were all tight, right? So even just slight movements like that is good to do. Okay. All right. So there's some health strategies for coping with stress. What a surprise. Eating healthy, right? So eating healthy, drinking water, fruits and vegetables, nuts, right? Anything that's from nature, right? Processed food is not from nature. That's man-made. That's chemicals, right? So pay attention when you're stressed. What are you eating? What do you gravitate towards? Do you go to McDonald's, right? Or are you grabbing an apple? Or some of us, when we're stressed, we don't eat, okay? So pay attention to what those habits are. Exercise, okay? And that's what we just did right now, okay? Exercise is a great de-stressor. Playing games, hobbies, laughter, watching a comedy show, going to a comedy show, being around positive people, being around people who make you laugh, make you feel good, okay? Prayer is good, right? Different things for different people. Now, if you haven't tried something, give it a try. You may be pleasantly surprised that it's going to work for you. Meditation. There's so many wonderful programs now out at all the local rec and parks and the senior centers, various programs at your faith-based organization of meditation, whether it's Tai Chi, whether it's yoga, whether it's just listening to music, listening to the ocean. And meditation is going down to the beach and just sitting there listening to the ocean water, right? Going up to the mountains, just watching the gorgeous view, okay? Going to a park, okay? And even just closing your eyes and putting yourself in a good place, okay? Where is that place that you want to be? Who would you want to be next to? What would you be wanting to do? Okay? Religion. Again, whatever that religion is for you, okay? Whether it's of a specific religion or whether it's more spiritual based. And we're going to look at some other relaxation techniques. So relaxation techniques helps with anxiety, helps with insomnia. I'm sure if I ask a show of hands, how many people have difficulties sleeping or getting up in the middle of the night, right? Labor pains, anyone who's going through chemotherapy, right, for induced nausea, TMJ, so that's that tightening of the jaws, right? Managing chronic headaches, right? Some of us have these chronic headaches. And so they've shown links with doing different types of meditation, how it reduces, and for some of us actually totally takes away the head pain that you're experiencing. And sometimes incorporating working with a therapist, whether it's a psychologist, a counselor that can help you in the process, giving you some tools to help you cope differently, right? All of us may go through different life stressors, whether it's a loss of what have you, whether it's a financial, a partner, a home. There are resources for you, healthy ways of coping through and getting through this phase. So what is relaxation all about? So this is it. Any type of relaxation, the goal is similar for any of them. It's to produce the body's natural relaxation response, characterized by slower breathing, right? Lower blood pressure, and feelings of increased wellness. So here are some techniques. Let's see if we can get that on. So one is called progressive relaxation. One is called guided imagery. What's great is now on YouTube, you could pull up some of these and for free, try out different ones and see which one works for you. There's biofeedback, and some of these also with your healthcare provider, they will also access and utilize and refer you to. Self-hypnosis, deep breathing exercises, right? Just breathing and breathing right. And then different types of meditation. And the last one says stress management programs. So there are various programs out in the community. Some of them are available at our senior centers. Some of them are available at our rec and park that you can go ahead and access for free. And then to keep track of the time, I'm running through this a little fast, but to be respectful of your time. So again, 5 things to make sure that you take care of your health, keep it in order, is getting that annual physical, coordinating with whoever your physicians are, okay, be active participant in it. Advanced directives, Janet is going to share with you more about that, and there's a whole series that she's going to address. Medication management is critical, and healthy strategies to cope with stress.